Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Today, we want to explain our work group about kinds of pregnancy complications. Before that, I want to introduce my group. Our group consists of Akrimna Hendarika, Rahmahayu Wiyandani, Salma Nur Fadila, Wasingatin Catur Khasanah, Berlian Adzkiya, and Farikha Nailil.
Okay, next, the maternal mortality rate in Indonesia show an increase from year to year, which can be seen from the result of the 2007 EDHS, where maternal mortality from 228 per 1,000 live births rose to 359 per 1,000 live births in 2012. Not all mothers participating in antenatal practice the preventive or pregnancy complication according to the advice. There was perception gap with the not yet optimal complication preventive practice. Practice was not directly caused by attitude because it was determined from more by perception that were from participation in AC and facilitator support. Perception and support influence the complication preventive behavior. Family or community should be dominant influencing and reinforcing factor. Stroke socialization, assistance, and counseling from health worker and strengthening from family or community could improve pregnancy complication preventive behavior.
Next, the kinds of risk and complication in pregnancy that can occur include hormonal problems, the mother uterus, the placenta, and development of the baby and the cervix. If left untreated, this complication can have fatal consequences for both of mother and the future baby. Here are some examples of complications that are common during pregnancy. One is hypertension or high blood pressure in pregnant women. If the blood pressure of pregnant women with gestational age after 20 weeks reach 140 mmHg, it can cause seizure or eclampsia. Another symptom is swelling of one or both lines caused by increased level of potassium in urine. Two is bleeding. Bleeding doesn't only occur during labor, but can also occur during pregnancy. Bleeding during pregnancy is considered abnormal if the cause is related to the placenta, uterus, and recursion in the vaginal area. Three is premature rupture of membranes. This is a condition in which the water breaks before labor begins, even before the mother feels contraction. Disease can occur in mother who smoke active or passive, have a history of sexual transmitted infection, and if mother who have never give birth to a premature baby of experience multiple pregnancies. Four is anemia. Anemia is in pregnant women should not be underestimated because it can cause premature birth of babies and even fetus that cannot develop optimally. Five is morning sickness and or hyperemesis gravidarum, a condition in which pregnant women will feel nauseous and vomiting throughout the day. It can cause difficulty sleeping at night. This will stop when the womb is above 20 weeks, but not infrequently this morning sickness continues throughout pregnancy.
Okay, next is causes of pregnancy complication. There are several causes of pregnancy complication. Mostly, the main cause is unhealthy lifestyle before and during pregnancy. Another cause are genetical factors and environment. Medical history should be checked before pregnancy as for prevention. Several diseases of pregnant women such as heart disease, high blood pressure, asthma, seizure, and diabetes will greatly affect the development of pregnancy during pregnancy and childbirth. The risk of pregnancy complication will increase drastically after age 35 years old.
Okay, the next is impact of pregnancy complication. Complication of pregnancy if early detection is not carried out, the impact that will occur is the assurance of further complication that result in the death of mothers and babies. The high number is neonatal death is a direct result of poor pregnancy and birth management. In Nigeria, 50,000 women die each year due to complication of pregnancy and childbirth. In Nepal, 4,500 women die each year from the same cause, and the maternal mortality rate in Indonesia shows an increase from year to year. Years that can be seen from the result of the 2007 IDHS, where maternal mortality from 228% increased to 359% in the 2012 ADHS.
Uh, some pregnancy complications can be treated with medications, but there are also pregnancy complications that cannot be prevented or cured. For example, if complications are caused by an abnormal growth of the fetus, there is no medical help to assist the pregnancy.
Next, as for the way to prevent pregnancy complication, namely A. Carry out examination as recommended by health workers and according to government policy standards, which is at least 4 times during pregnancy. B. Pregnant women get support from their family and close people, especially their husband. C. Administration of tablets FA for pregnant women. D. Health works can carry out midwifery care in pregnant women according to standards, so that it can make the effort prevention of complication pregnancy well. And the last, can complete the facilities health, especially for pregnancy care, in order to implement the standard with good.
Uh, that's all for the explanation. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.